Good afternoon. I'll start my presentation now. Patients with chronic prostatitis often exhibit irritative bladder symptoms, despite no evidence of bladder inflammation. Previous studies in animal models demonstrated that prostatic inflammation can induce bladder overactivity. However, the underlying mechanisms for PI-induced afferent sensitization are not fully elucidated. Inhibition of histamine-H1 receptors is reportedly effective for the treatment of pain and other bladder symptoms in patients with interstitial cystitis bladder pain syndrome. The present study examined the effect of a second-generation anti-histamine-H1 receptor antagonist in a rat model of non-bacterial prostatic inflammation. SD rats and divided them into 3 groups per 6 rats. Sham group of control rats without intraprostatic installations and with oral administration of an HD1R antagonist, desloratine. Placebo group of prostatic inflammation rats with oral administration of vehicle and treatment group of PI rats with oral administration of desloratine. First, on day 0, PI was induced by intraprostatic formalin injection in placebo and treatment groups. In these 2 PI groups, vehicle and desloratine was respectively administered daily by oral garbage for 14 days from day 14. Finally, on day 28, we performed conscious cystometry and harvested tissues to evaluate molecular and histological analysis. In cystometry, treatment group had significant longer interconduction intervals than placebo group, in which ICI was significantly reduced compared to sham group. This result indicates that PI-induced bladder overactivity was improved by desloratine treatment.
In cystometric parameters, placebo group has significantly higher post-voided volume and lower voiding efficiency than sham group, while there were no significant differences in dose between treatment and sham groups. These results indicate that desloratine treatment improved voiding dysfunction after PI.
In the prostatic tissue, epithelial atrophic changes and inflammatory cells in stroma were observed in placebo group compared to sham group. These changes were lesser in treatment group compared to placebo group, while there were no significant differences among all groups in the bladder tissue. This result indicates that desloratine treatment improved prostatic inflammation. Messenger RNA expressions of interleukin-1 beta and interleukin-18 in the prostate of placebo group were significantly higher compared to sham group, while there were no significant differences between treatment and sham groups. These results also indicate that desloratine treatment improved prostatic inflammation. In placebo group, messenger RNA levels of TRPV1 in the prostate and L6S1-DRG were significantly increased compared to sham group. However, these changes were normalized in treatment group. These results indicate that PI-induced TRPV1 upregulations in the prostate and afferent pathway were improved by desloratine treatment. In placebo group, messenger RNA expression of HG1R in the prostate and the bladder were significantly increased compared to sham group. However, these changes were normalized in treatment group. This result indicates that PI-induced HG1R upregulations in the bladder and prostate were improved by desloratine treatment.
This is a summary of this study.
Blockade of histamine-H1 receptors improved not only prostatic inflammation but also bladder overactivity in a rat model of PI. The histamine-H1 receptor mechanism would be a potential target for the treatment of irritative bladder symptoms in patients with chronic PI. It's possible that second-generation anti-histamine-H1 receptor antagonists such as desloratine can induce therapeutic effects without affecting PI-associated voiding problems.